Sanbonani on this beautiful day. I just want to come here and give unsolicited advice to the interns starting internship this year. I just really want to start by saying congratulations. You did that. You are that girl or boy. You passed med school. That was hard, difficult. You did it, and congratulations. You belong. You are competent for the job, and take that with you, because there will be a lot of times where you're going to feel incompetent, or you'll be made to feel stupid, or you'll be made to feel like you didn't get this degree on merit. So take that with you. The first thing I would say is, 1, take your lunch break. It's frowned upon in our profession to take lunch, but do it. You're not gonna burn yourself trying to keep a broken system ablaze. Take a lunch break, take a rest if you need to. You need it. There will always be work. There will always be work. It does not end. Even if you think you want to clear the queue before you go, the queue will never end. So take the lunch break. It's very important. I ended up getting IBS because I wasn't eating correctly, and I was starved for another day. So take your lunch break. Sometimes your colleagues will think you're lazy if you do that. They will speak behind your back. They will say things. It doesn't matter. Just take your lunch break. Retrospectively, I wish I would have done that, and the times where I started doing that, I wish I would have done that more often. So even now I'm still struggling to do that, but this year is the year where I practice what I preach. So that's number 1. Secondly, it will be, don't make enemies where there are none, especially with your colleagues. Have teamwork, help each other. Literally, there's no need to try to shine. There is a lot of work. More than you need to be the star of the group, you need teamwork, because there's a lot of work. And if you guys can help each other, it will go a long way, especially when you are post-call. You know, when you're post-call and you still have post-call work to do, it comes a long way if you have colleagues that are willing to do that work for you, and that you can do umsebenzi wabo as well in return when they are post-call. You know, teamwork, especially post-call, is where it's important. But do it even during the week. I mean, if you guys are in a rotation where once you're done you can leave, then help each other so that you all can leave early, because you don't really get a lot of time, hey? So if you can, work as a team, get the work done, and then leave early. Third advice is, as I said, you're a doctor. You're not a student anymore. You are paid for the job, right? So do the job. This thing of clacking patients as if you're third year and leaving plans is trash. That is for third year students. That's for final year-ish. Even in final year, you should have, especially in final year, you should have attempted to make a plan. So you're not getting paid to make the right diagnosis only, and we clap for you and you get a golden star. You're paid to actually make plans and implement those plans. But lo and behold, you're not alone. Your seniors are there to help you, but they're not there to teach you med school now. You should have learned those things in med school. Yes, you can't learn everything in med school, but the management of basic things you should have learned in med school. You can't be out here teaching you basics. So by all means, refresh, read your notes. The best apps to get are EM guidance. Make sure you get EM guidance. It really just tells you management of everything, basic things. So use EM guidance. I know a lot of people talk about what's this, up to date. Up to date is complex, bro. Like, you click one link, it leads you to the other, it leads you to the other, and also it's expensive because you need a subscription. If you had that subscription in varsity, I would advise that you keep it, you activate it, because you will need up to date, especially if you're doing presentations. It can be great. But for day-to-day work and that's like I don't know, it's just too much. So but if you can get it. And then the other one that I liked was Medscape. Medscape was nice, man. If you can read Medscape, do it. It was great. But it can be long, obviously. But like, I'll say get at least Medscape and EM Guidance. That will help you. So it's no excuse, man, to have a patient that's pregnant, presenting with PV bleeding, and you only do a PV. I don't know, man. It's just like I don't know. At least have a plan. Like all I'm gonna say is at least have a plan. Have a plan that your senior can help you implement. But your diagnosis can't be PV bleeding in pregnancy. I'm sorry, you have to think. Like you were able to give differential diagnosis for PV bleeding in early pregnancy. At least with that auth, you should, be able to ascertain which one it is. If it's closed, it's this. If it's open, it's this. Like just do that. Okay. So another one I would say is apply yourself as much as you can. Apply yourself as much as you can. Even if maybe you don't like internal medicine, but when you're in internal medicine, learn as much as you can. You might never manage I don't know, man, CCF again in your life, but you are there now. We don't really care where you want to specialize in the future. You are doing internal medicine now, so do what's expected there. I didn't like surgery, but I applied myself in surgery. I actually enjoyed surgery. I enjoyed the theory of surgery. I liked knowing things. I did BKAs. But did I like surgery? No. But it's not excuse to not know how to manage basic conditions because you're not going to specialize in that department in the future. That's just trash. Apply yourself. You're getting paid to do a job, so do it again. Another one will be what else? Know which battles to fight, right? Not everything needs to be created. Not everything needs to be addressed. Know which battles to fight, but also don't be a pushover. Don't be a pushover. Be assertive. Address people with respect. I think sometimes it's not a matter of addressing or not addressing an issue. It's a matter of how. When you're speaking to people, speak to people with gentleness and respect. Be assertive where you need to be. Forgive. Don't take things personally. But literally don't make enemies unnecessarily. Okay. The other one is get along well with nurses. I think people say that all the time, so I'm just gonna skip that. But also hold them accountable, man. Yes, I'm your friend, and yes, we get well. I'll just say have mutual respect for everybody. Cleaners, porters, others. I'm telling you, if you just show respect to everybody, your work will be so much easier. Those people will be willing to assist you. The nurses will give you statues. I know for the time it was difficult to get their lab forms. I got along with the matron all the time. She would give me my own stat. She would give me my own progress notes. And I also was extra when I was doing internship. I had this huge briefcase where I used to put all my things. So but if you get along with people, I'm telling you, mutual respect. Don't be manipulative, don't be a gunner. But if you get along with everyone, your work will be so much easier. So by all means do that. What else? Yeah, I think those are the ones I'll have to say. And then I'm sure others will say if you can do the basic courses like BLS and ACLS and stuff. I didn't do it, so I did it in ComServe. If you can do it, people are different. I do think that internship is a lot as is. So if you can just focus on internship. But if you also can manage to do these courses, for those that did them, it worked for them. For me, I'm doing CampEd now. It really means nothing. I didn't need it. But because like now unemployment is really a problem, make sure that you're doing as many courses as you can while you have time, because in terms of to do everything and then apply and wada, it's gonna be difficult actually. So in light of that, just make sure you do these courses as early as you can. And then what else? Enjoy it, man. Oh, before I forget, because this is more for me than it is for everyone else. Stop being a people's pleaser. Like, stop. Like, get over that. Get over if you're doing good. Like, people will be like, no, well done or whatever. I'm glad that I got over that nonsense very early. Now, you must understand, I'm a perfectionist. I want to do well. I'm my biggest critic. If I don't get the answer right, I will meditate on that, what I said and be wrong, and then I'll beat myself up about it or whatever. That's it. Get over it. Get over that, study, read your work, be knowledgeable, participate in word rounds, do the most. But man, no one is out here giving golden stars. So do your work, try to excel best you can, but man, don't expect people to clap hands for you all the time. If they do though, don't brush it off. Sit in it, don't let it get to your head. Just I'm grateful, like I did well, like, because you, as I said earlier, there'll be a lot of moments that make you feel stupid, I guess. So if you have moments that celebrate you, just have an internal trail of them, so that you remind yourself, well, it's not, man, you're competent, you've done well, you've passed med school, you didn't get here, no one gave you this degree, you worked hard for it. But don't expect golden stars. I've seen some of the people that are hardworking and they're grumpy people because somewhat they're expecting someone to always clap for them for the fact that they arrive early. If you arrive early at your own merits. Now, don't expect everyone else to arrive early. Don't expect everyone else to make the sacrifices that you were willing to make, right? So if you want to get there early, especially in the first few weeks, because you are going to be slow. You don't know where things are, so I mean, it won't kill to get there early and do the work and take time to like clock your patients, study around the condition, read EM guidance for the management of that condition and stuff before you, like, your MO comes and they ask you for blood results and stuff. And also like post-call, like, go there earlier to see your patient so that by the time ward rounds like are happening, post-intake ward rounds are happening, you know what is going on, the patient results are already printed and they are attached, where the patients are, it helps if you get there a bit earlier. But for day to day, if you're willing to do that, don't be grumpy if other people are not willing to do that. Don't call them lazy. Everyone is paid to get there at 8 to 4 or whatever. So if you're willing to get there at 6, it doesn't mean that everyone is getting there at 6, because that's 2 hours unpaid. So leave people alone. So yeah, all in all, make friends. I'm also good at making friends. I'm a loner, bruh. I had very few friends, but very lovely people. So make friends. Have a community. Find a church community. Enjoy it, man. It's only 2 years of your time, and to be honest with you, it hardly gets better. It hardly gets better in terms of work. Medicine is hard. Medicine is a lot of work. ComServe is a lot of work as well, and when you're specializing, it's also a lot of work, really. So bruh, enjoy it, and once again, congratulations.